So someone commented on my recent video about how elitist UK medicine is because we have all these portfolio requirements that you have to do alongside your degree to even stand a chance of getting into your job of choice. Friends, I completely agree. I think some of the things we need to do to stand a chance of competing for the jobs that we want as doctors are completely unnecessary. Things like research, publications, conferences. I don't think you need any of that to be a doctor. And to be honest with you, the kind of research that medical students and junior doctors can do, that they can fit around their busy schedules, it's not what most academics and scientists would consider research. Meta-analysis, systematic reviews, quality improvement projects, audits, some of those are useful to know how to do as a doctor because you should, as a clinician, be invested in improving the place you work in, so, you know, your trust, the NHS. So I can see why quips and audits are relevant. But like meta-analyses, systematic reviews, letters to the editor, these are all just things medical students and junior doctors do for the sake of an application. I've not known a single person who's done one because they actually have an interest in that topic. And I don't think any of this should be a requirement for getting into training. I have friends who are no doubt fantastic clinicians and surgeons, but they failed to get into training time and time again because they are lacking portfolio requirements, such as research that they have no interest in doing, and they shouldn't need to. You need to practice medicine and learn how to manage your patients, do certain operations and procedures, be a good doctor or surgeon or whatever it is you want to be. These are all skills you learn on the job. Research isn't and should not be a requirement to have a job like that. These portfolio requirements, if anything, only encourage medical students and junior doctors to pursue low quality work just for the sake of ticking a box. I've encouraged people to do this because that is currently the way the system is set up, so you have to play the game. It should not be the way the system is set up. If you want to do research long term like I do and you want to be a clinical academic, research currently is a requirement for academic training routes, as it should be. And having done a PhD, I stand by the fact that you will not know what research is like until you do one. And by that I mean learning how to think for yourself, identifying gaps in the literature, coming up with testable hypotheses and practical ways to actually test those hypotheses instead of being told exactly what to do by your supervisor. Post-PhD, you should not have your hand held. And I think all of that is important if you want to do actual research. And if that's the kind of research you want to do, which is really cool, a 10 out of 10 recommend, then I highly encourage you to do research projects with labs, so basic science projects. That's where you'll learn all of these skills. If you want to learn how to do a systematic review or a meta-analysis for fun because you want to build that skill, then that's cool, go for it. But none of this should be a requirement to get into clinical training, in my opinion. Maybe it's a controversial one, I don't know, I could rant about this for ages.